It's 3 in the morning. The house is dark and still, except for the inconsolable cries echoing from your baby's room. You've tried everything, feeding, changing, cuddling, yet the crying persists. The exhaustion is setting in, and you're starting to feel overwhelmed. Trust me, I know exactly how you feel. If you're dealing with a colicky baby, you're not alone. Colic is a common and often frustrating experience for many parents. But take a deep breath because things will get better. This video is here to provide you with practical advice and support to help you navigate this challenging time. So, let's dive in and discover how to navigate the world of colic together. Colic is a term used to describe excessive, inconsolable crying in an otherwise healthy baby. It typically begins in the first few weeks of life and can peak around 6 weeks. While the exact cause of colic remains unknown, several factors are believed to contribute, such as an immature digestive system, gas, or overstimulation. The good news is that colic usually resolves on its own by 3 to 4 months of age. Understanding the characteristics of colic can help you differentiate it from other potential issues. In the next section, we'll delve into practical strategies to soothe your colicky baby and bring some peace to both of you. Dealing with a colicky baby can feel isolating and overwhelming, but remember, you're not alone. Millions of parents around the world have experienced the challenges of colic. This video is here to provide you with practical tips and techniques to help you navigate this challenging phase. From swaddling to white noise, gentle rocking to tummy time, we'll cover a range of strategies to help calm your little one. Remember, what works for one baby may not work for another, so it's important to experiment and find what soothes your individual child. Navigating colic requires patience, persistence, and a healthy dose of self-care. Remember to take breaks when you need them and reach out for support. Let's dive into the specific techniques and strategies to help soothe your little one and bring some calm back into your home. Colic is a term used to describe excessive, inconsolable crying in an otherwise healthy baby. It's a common condition that affects many infants, typically starting in the first few weeks of life. While the exact cause of colic remains a mystery, several factors are believed to play a role, including an immature digestive system, gas, and overstimulation. The crying associated with colic is often intense and high-pitched, lasting for extended periods, typically in the late afternoon or evening. Knowing that colic is a phase can provide reassurance during those challenging moments. This video is here to provide you with the knowledge and tools to manage colic effectively and support both you and your baby through this phase. Recognizing the symptoms of colic is the first step in addressing the issue and finding ways to soothe your baby. These include prolonged crying spells, typically lasting for 3 or more hours a day, occurring at least 3 days a week, and persisting for 3 or more weeks. Colicky babies often cry with a high-pitched, piercing sound that can be particularly distressing for parents. They may also exhibit physical signs of discomfort, such as clenched fists, drawn-up knees, a tense or distended abdomen, and excessive gas. If you're concerned about your baby's crying, it's always best to consult with a pediatrician to rule out any underlying medical issues. Once you've determined that your baby is likely experiencing colic, you can begin exploring various soothing techniques and strategies to help calm your little one. The rule of threes is a helpful guideline for identifying colic in babies. It refers to the characteristic pattern of crying that often accompanies colic crying for more than 3 hours a day, for more than 3 days a week, and for more than 3 weeks. While this rule can be a useful indicator, it's essential to remember that it's not a definitive diagnosis. Some babies may exhibit colicky symptoms without strictly adhering to the rule of threes. Understanding the rule of threes can help you differentiate colic from normal infant crying. With the right support and strategies, you can navigate this challenging period and find ways to soothe your little one. Dealing with a colicky baby can be incredibly challenging, both physically and emotionally. The constant crying, the sleepless nights, and the feeling of helplessness can take a toll on parents. It's during these times that it's crucial to remember that colic is a phase, not a failure. It's not a reflection of your parenting abilities or a sign that you're doing something wrong. In the next section, we'll explore various soothing techniques and strategies to help calm your little one and bring some peace to both of you. Swaddling can be a remarkably effective technique for soothing a colicky baby. It mimics the snug feeling of the womb, providing a sense of security and comfort. When swaddling your baby, ensure the swaddle is snug but not too tight, allowing for some movement of the hips and legs. Choose a lightweight, breathable swaddle blanket made of natural materials like cotton or muslin. Swaddling can be particularly helpful during fussy periods or before bedtime. It can create a sense of calm and help your baby transition to sleep more easily. However, it's important to discontinue swaddling once your baby shows signs of rolling over. With a little practice, you'll become proficient at swaddling, and your baby will likely appreciate the comforting feeling of being snugly wrapped. Rhythmic movement and rocking can be incredibly soothing for colicky babies. The gentle motion can mimic the sensations they experienced in the womb, creating a sense of familiarity and comfort. Try holding your baby close and gently swaying back and forth, or walking around the room while bouncing them gently. You can also use a rocking chair or glider to create a calming, rhythmic motion. Experiment with different types of movement to find what works best for your baby. Some babies prefer a slow, gentle rocking motion, while others respond better to a more vigorous bouncing or swaying. With a little patience and experimentation, you'll likely find a rocking or swaying technique that helps soothe your colicky baby. White noise can be a surprisingly effective tool for calming a colicky baby. The consistent, low-frequency sound can help mask other noises and create a more peaceful environment. There are many sources of white noise you can try, such as a white noise machine, a fan, or even a vacuum cleaner. Experiment with different sounds and volumes to find what works best for your baby. The key is to create a consistent, soothing sound that helps block out other distracting noises. With a little experimentation, you may find that white noise becomes an invaluable tool for soothing your colicky baby and promoting restful sleep. While it might seem counterintuitive to place a crying baby on their tummy time can actually be beneficial for colicky babies. It can help relieve gas and improve digestion, which can contribute to colic symptoms. Place your baby on their tummy on a soft, flat surface for short periods, always under your supervision. Start with just a few minutes at a time and gradually increase the duration as your baby gets stronger and more comfortable. Tummy time also helps strengthen your baby's neck and back muscles, which is essential for their development. It can also help prevent flat spots on the back of their head, which can sometimes occur from spending too much time lying on their back. During tummy time, engage with your baby by talking, singing, or making funny faces. This can help make the experience more enjoyable and stimulating. If your baby resists tummy time, try placing them on your chest or lap while you're reclining. This can provide a more comfortable and supported position. You can also try placing a rolled-up towel or blanket under their chest to provide additional support. Remember to choose a time for tummy time when your baby is awake and alert, but not overly fussy or tired. Avoid tummy time immediately after feeding, as this can increase the risk of spitting up. With patience and persistence, your baby will likely come to enjoy tummy time and reap its benefits, including potential relief from colic symptoms. The power of touch can be incredibly soothing for a colicky baby. Gentle massage can help relax their muscles and ease tension. Use a hypoallergenic baby oil or lotion and gently stroke your baby's back, tummy, arms, and legs. Pay attention to your baby's cues and adjust the pressure and pace of your massage accordingly. If your baby seems uncomfortable or resistant, stop the massage and try a different soothing technique. Skin-to-skin contact can also be very calming for both you and your baby. Hold your baby against your bare chest, allowing them to feel the warmth of your skin and hear your heartbeat. This can create a sense of security and closeness, which can be particularly comforting during fussy periods. Cover your baby with a blanket to keep them warm and maintain their privacy. You can also try gently patting or rubbing your baby's back while holding them upright. This can help relieve gas and provide a sense of comfort. Another soothing technique is to gently stroke your baby's forehead or temples. This can be particularly calming during times of distress. Remember to always use gentle, loving touch when interacting with your baby. Your touch can convey a sense of security and comfort, which can be invaluable during the challenging times of colic. Experiment with different types of touch to discover what soothes your baby best, and always prioritize their comfort and well-being. Feeding practices play a crucial role in managing colic. If you're bottle feeding, ensure the bottle nipple flow is appropriate for your baby's age and feeding pace. A nipple with a flow that's too fast can lead to overfeeding and increased gas, while a flow that's too slow can frustrate your baby and cause them to swallow air. Experiment with different nipple sizes and flow rates to find the perfect fit for your little one. Pay attention to your baby's hunger cues and feed them on demand rather than on a strict schedule. Overfeeding can exacerbate colic symptoms, so offer smaller, more frequent feedings if necessary. Hold your baby upright during feedings and keep their head higher than their stomach. This can help prevent air from entering their digestive system and reduce gas buildup. After each feeding, hold your baby upright for at least 20 to 30 minutes to allow gravity to help settle their stomach contents. Avoid vigorous play or activity immediately after feeding. If your baby is formula fed, consider switching to a different formula designed for sensitive tummies. These formulas are often easier to digest and may help reduce colic symptoms. Always consult with your pediatrician before changing formulas or making any significant changes to your baby's feeding routine. They can provide personalized guidance based on your baby's individual needs and health status. With careful attention to feeding practices, you can help minimize colic discomfort and promote a happier, more content baby. Section 2. Burping Techniques, a gas buster's guide. Burping your baby effectively is essential for relieving gas and reducing colic symptoms. There are several different burping positions you can try. One common method is to hold your baby over your shoulder, supporting their head and chest with one hand while gently patting or rubbing their back with the other. The gentle pressure and motion can help release trapped air bubbles. Another effective technique is to sit your baby on your lap, facing away from you. Support their chest and chin with one hand, ensuring their head is slightly tilted forward. Use your other hand to gently pat or rub their back. This position allows gravity to assist in the release of gas. You can also try laying your baby face down across your lap, supporting their chest and chin with one hand while gently rubbing their back with the other. This position can be particularly helpful for releasing stubborn gas bubbles. If your baby doesn't burp after a few minutes, try switching positions or gently moving their legs in a bicycling motion to help move gas through their digestive system. Remember to always support your baby's head and neck properly during burping. Be patient and persistent, as it may take some time for your baby to burp. With a little practice, you'll find the burping techniques that work best for your little one and provide much-needed relief from gas and colic discomfort. Section 3. Dietary considerations for breastfeeding mothers. If you're breastfeeding, certain foods in your diet may contribute to your baby's colic. Common culprits include dairy products, caffeine, chocolate, and cruciferous vegetables like broccoli and cabbage. While it's not necessary to eliminate these foods entirely, you can try temporarily removing them from your diet to see if it makes a difference in your baby's symptoms. Keep a food diary to track what you eat and how your baby reacts. If you notice a connection between certain foods and your baby's colic, try eliminating or reducing your intake of those foods. It's important to maintain a balanced and nutritious diet while breastfeeding, so consult with a registered dietitian or lactation consultant before making any significant dietary changes. They can help you identify potential trigger foods and ensure you're still getting the essential nutrients you and your baby need. Reintroduce eliminated foods one at a time and monitor your baby's reaction. This will help you pinpoint any specific foods that may be contributing to their colic. Remember, every baby is different, and what affects one baby may not affect another. Be patient and observant, and work closely with your healthcare providers to find the best dietary approach for you and your little one. With careful attention to your diet, you can help minimize your baby's colic discomfort and promote a happier, healthier breastfeeding experience. Creating a calm and relaxing feeding environment can also contribute to colic relief. Choose a quiet, dimly lit space where you and your baby can feel comfortable and relaxed. Minimize distractions and interruptions during feedings. Turn off the television, silence your phone, and create a peaceful atmosphere that promotes bonding and relaxation. Hold your baby close and make eye contact during feedings. This can help foster a sense of security and connection. Speak to your baby in a soothing voice and gently stroke their head or back. These small gestures can make a big difference in creating a positive feeding experience. After feeding, hold your baby upright for at least 20 to 30 minutes to allow gravity to help settle their stomach contents and reduce the risk of reflux and gas. Avoid bouncing or jiggling your baby immediately after feeding. Instead, hold them gently and allow them to relax in your arms. Creating a calm and nurturing feeding environment can contribute to a more positive experience for both you and your baby. It can also help minimize colic discomfort and promote a sense of peace and well-being. By prioritizing relaxation and bonding during feedings, you can create a more enjoyable and fulfilling experience for both you and your little one. We've covered a lot, from understanding colic to soothing techniques. Remember, colic is temporary and usually resolves by 3 to 4 months. Techniques like swaddling, white noise, and tummy time can help. The power of touch is also soothing. Adjust feeding practices and consider dietary changes for breastfeeding mothers. Consistency is key, even if results aren't immediate. Millions of parents have faced colic and emerged stronger. This phase will pass, and you will get through it. While colic is typically benign, certain situations require medical advice. If your baby's crying is accompanied by fever, vomiting, or diarrhea, contact your pediatrician immediately. These could be signs of an underlying issue needing prompt attention. It's better to err on the side of caution and seek professional guidance. If crying seems excessive or different, consult your pediatrician. They can assess your baby's health and rule out other causes. Seeking medical advice shows your commitment to your baby's well-being. As we wrap up, remember the importance of self-care and seeking support. Caring for a colicky baby is demanding. Prioritize your well-being to be the best parent possible. Take breaks when needed, ask for help from family and friends, and engage in activities that bring you joy. By taking care of yourself, you'll handle colic better and support your baby. Connect with other parents of colicky babies. Sharing experiences provides valuable insights and support. If you found this helpful, give a thumbs up and subscribe for more tips. Thanks for watching, and see you in the next video.